Remember, the content on our show is for information only.
It is not intended to provide medical or other professional advice. Hi, and welcome to Placebo, the podcast where we take turns teaching each other something new or interesting about healthcare or medicine. My name is Kaylin Richards, and this is my brother.
And I'm Logan Richards.
So we've talked before about animals relating to health.
Yes.
I think we had an episode quite a while ago that was about general, like, pets and how they affect your health.
I think so, yes.
So today I decided to research...
We weren't recording in our studio at that point.
No.
I think that was one of our very first episodes.
I think you're right. A long time ago.
Mm-hmm.
So you could go back to that episode if you want a recap of our findings. And what I'm remembering is that there was general support for having pets generally increase your health, both from a fitness standpoint and from a mental health standpoint. So I recently was scrolling along through Facebook, as you do sometimes, and I saw some video posting someone has shared about a family who had gotten a dog for their child with autism.
Okay.
And the child had been really had a lot of difficulty with relationships, even with their immediate family. But then they had gotten the dog, and they'd had a lot of pretty quick turnaround in their ability to talk and in their ability to interact with their family, and the parents were like attributing it to the dog.
Okay, interesting.
So I saw the video and I thought, oh, that's very nice. That was a very sweet video.
Facebook videos are never the
but I wondered,
most trustworthy.
No, yeah. So I thought, maybe it's showing their experience, but is this representative of any research? Is there any research about this?
Sure.
So I guess let's give some basic info on two fronts, maybe starting out with autism. I think people are very familiar with that. It's something that's kind of been in the news fairly regularly, I would say.
I think people are familiar with the basics of autism, but probably not a lot of the details.
So we'll talk a little bit about autism first. It is known now as autism spectrum disorder. I think you hear that term also a lot,
right.
Which indicates in the term that it is a wide variety of symptoms and how it affects people.
Right.
In the DSM-5, it's defined as a heterogeneous...
Did you say what the DSM is yet?
Diagnostic and statistical manual used by psychiatrists, psychology professionals to define what different conditions are.
Sure.
So anyways, autism spectrum disorder is a heterogeneous condition, meaning, like I said, it's variable in how it presents in different people. Mm-hmm. And it typically, though, it involves persistent difficulties with social interaction in a variety of contexts and in like restricted or repetitive behaviors.
Okay.
Does that make sense to what you know?
Sure. Yeah.
Okay. The other things to think about are that
wouldn't matter if it didn't make sense. That's what it is.
These two problems must have been present since early childhood. Sometimes they can be present from birth, and they can't be explained by other intellectual disorders or developmental delays.
Okay. So it's kind of you have to rule everything out first.
Other things that could be causing these symptoms.
Right.
Yeah. Also, like the term spectrum kind of also points that it is very complex and individualized, that there often are other developmental disorders that occur in conjunction with autism.
Okay.
So sometimes it's very hard to maybe specify which are the exact symptoms due to autism versus something else that the child might have.
Sure. So we know the definition is broad and wide-ranging, but can have a few...
The main points are difficulty with social interaction and like type of repetitive behaviors.
Okay, so those are common traits even within the whole wide-ranging spectrum of the disorder.
Yes.
But everything else can be kind of different.
Right. It can range from someone who's nonverbal to someone who's like very verbal, completely independent, functionally, that sort of stuff.
Okay.
Okay. The other thing to talk about before we get into the general research about autism in dogs is I just thought briefly touch on how dogs have been used as kind of specifically as a therapeutic medium, I guess. I don't know if that's the right term.
Yeah, well, I think so. Because our first episode was just kind of the existence of dogs and how they affect one's health, not necessarily with the intention of being therapeutic or...
Right. So this is looking at, how do they intentionally do that.
Right.
So I just thought I'd give some examples, some historical examples of the use of dogs.
Therapeutic puppies.
Therapeutic puppies. So starting way back, Florence Nightingale was known for using animals with her patients.
Okay.
She called this animal companion therapy.
Sure.
And this was in the early 19th century, and she felt that they were important to help the healing process. I don't think she did any specific research. That was just her observation.
Well, at that time, you didn't need quite as much.
No. Although it's interesting because I think Florence Nightingale was known for her emphasis on like cleanliness and preventing infection and stuff. And you'd think that she might be against having dogs in the hospital ward or something because they can have a reputation that they might spread disease, especially in a time when they were, probably weren't vaccinated dogs.
Depending on the dog, I suppose.
Yeah. Sigmund Freud, who's can be controversial figure maybe, but he was also believed that animals were really helpful in therapy, psychological therapy from his perspective. And he said, in quotes, that the dog had a special sense for helping people, I guess.
Okay.
He would bring his own dog, which was a Chow Chow, to his therapy sessions often.
I would have appreciated that.
Yeah. His dog was named Jofi.
Chow Chows have blue tongues, don't they?
They do, I think. They're the ones with the blue tongues. And also Akitas and Shar-Peis.
They're probably all kind of the same.
Maybe more closely related.
Yeah.
Okay. More recently, in the 60s, there was a child psychologist, Dr. Boris Levinson, who noticed that his patients were less anxious and had less resistance to participating in therapy when his dog, named Jingles, was present.
Jingles.
For an example, he noticed that one of his patients who had previously refused to speak at all during his therapy sessions would interact and would talk to Jingles prior to the doctor coming in. So he's like, Jingles definitely is helping him get a sense of rapport and helping people feel more comfortable.
I would have talked to Jingles.
I know. And I would say, so he's the one who coined the term pet therapy.
I didn't know that was a term.
It's a term. He coined it in 1964.
Good for him.
You mean you've heard therapy dog?
I've heard animal-assisted therapy.
Yeah. Like at my work, there's several dogs at the hospital that will come in with a volunteer that are therapy dogs. And I think I notice some of the things that are being talked about here and that people really warm up. They become more talkative when the dog comes in. It seems like a more positive mood a lot of the time.
Yeah. There's 2 dogs that visit regularly, and we always hear about...
At where you're at now?
Right. And the patients will always talk about the dogs when you ask them how their day has been. Mm-hmm. So, yeah, it's kind of the highlight of people's days when they're in the hospital.
And I notice even the staff gets all excited and comes over and sees the dog.
I love to see the dogs.
Yeah. So I think talking about how autism, one of the symptoms or main symptoms was that difficulty with social interaction, you can tell how maybe among people that don't have an autism diagnosis, it is still helping with social interaction, clearly, because people are kind of warming up when they see the dog, talking more.
Right. I would agree with that.
Yeah. So I guess the question then is now to look at the research specifically with autism in dogs and how does it affect people with autism?
Okay.
Okay.
So the thing you've set me up for at this point is that you already told me about the very wide-ranging symptoms and ways that autism spectrum disorder can affect someone. And
briefly,
so
yes.
You've already set me up with the thought in my mind that these types of experiments must be very hard and challenging to run because the disease is so heterogeneous.
Yeah. I mean, and actually one of the studies that I read in particular said studies will have exclusion criteria where they want it to be a very specific group that participates in their study treatment so that you can really tell specifically how the treatment affects people with a specific type of symptom.
Lots of specifics.
I know, I'm sorry. But they didn't do that really with their study. They only said you have to have a child between the ages of 2 and 16 that has an official diagnosis of autism spectrum disorder.
You haven't introduced the study yet.
I'll get there. But I just wanted to bring to your point in that they didn't have any exclusion criteria other than that because
in this first study we're going to look at.
And they talked about how it's hard to, their study kind of had variable results because of this, because people had such wide-ranging symptoms.
As I would expect.
Yeah. So I guess maybe we should talk about that one first, since I've already brought it up.
I would think so.
So it actually was one of 2 studies that came out within the last 2 years from the University of Lincoln in the UK. Okay. I thought maybe it was in Nebraska, but no, it was the UK.
I didn't even know there was a Lincoln in the UK.
Yes, I'd heard of that.
I only know King's College London.
That's the only one?
That's the only school I can think of. Maybe Oxford.
What about, Cambridge? Have you heard of that
I always hear King's College London.
When?
All the time. That's the only school.
Are people saying it to you?
Yeah, that's the only school you hear about.
Okay. Anyways, so the first of these studies, it was called What Factors Are Associated with Positive Effects of Dog Ownership in Families with Children with Autism Spectrum Disorder.
Okay.
So I should specify that all of the research with autism that I focused on was relating to pets, not trained therapy animals.
Okay.
Because that's kind of what I was interested on after seeing the little video on Facebook. That's what that was about, not a trained animal.
So still we're not going to be talking quite about trained therapy animals, but a little bit more in terms of therapy and the therapeutic use of the dogs, because they're meant to be our families getting these dogs in order to help their children with autism. Is that
so? I guess
or are these dogs that they've always had, or they would have had regardless?
No, they didn't get the dog until the study started, because that was part of the criteria to be included in the study.
Okay,
and so I think they recruited for the study by
people that were looking for dogs,
posting in these like autism family support groups, and they have like a specific group that's in the UK that was about autism support and dogs. So they were recruiting for this study, saying, "Are you interested in getting a dog? We're researching to see if it helps, families with children with autism."
Well, that's fun.
Yeah. So, anyways, I don't know how they specifically picked the dogs. They didn't talk about that, because I would think certain types of dogs might personality-wise themselves be more suited to
I would
to this work.
That.
Like a dog that's very nervous and doesn't like unusual behaviors or movements from people might not work very well with a child with autism who might have these repetitive movements or sudden movements or things sometimes.
There's so many variables. And then once you get a dog, how it further develops based on your family and your training and the routine that you set up for it, they're going to even further increase the variance of the dog's personality. And
exactly. And how old are these dogs when they're getting them, and what was their previous experience?
And there was none of that?
So I'm going to just present their overall conclusions, and then we'll talk about a few details.
Okay.
To kind of expand upon them. Okay?
Sounds good.
So they did find that differences in the type of family, the family features like one parent, two parent, how many kids in the family, is it just one kid, is it 6 kids, those sorts of things did not really affect how helpful the dog was in the family environment, but they felt that maybe should be better studied. They did find that the dog was overall helpful increasing social interactions with these children, considering overall. There were some families that had to get rid of their dog because, for various reasons, the dog was biting the children was one of the reasons given. So clearly it's not
the opposite effect
a 100% helpful thing. It really depends on a lot of the factors we were talking about. They did find that the best results, the greatest improvement in social skills was found with older children.
Okay.
And also those children whose parents attended workshop and training with the dogs.
Well, that makes sense.
Yes. So they also found a really weird thing. Okay. In that children who got the dog and also who had regular exposure to horses had the best results of all. So I thought that was kind of regular
once the experiment started, or regular in general?
They didn't specify about that. They were around horses regularly, as well as getting a dog. So the researchers thought that maybe exposure to social, non-human animals in general is maybe beneficial for the children.
What are they saying? Social, like dogs live in packs and horses live in herds?
I think versus not to stereotype cats, but Cats tend to be less social than dogs or horses, I would say.
This is a cat and dog people argument, isn't it?
No. And horse people.
How are they measuring social interaction from the children?
So it was all survey responses. They talked about the difficulty in this because with anytime someone is being observed, say the researcher just tried to come in and observe the child, that's going to affect their behavior, especially among maybe a child with autism that might react even more strongly to a change in routine, for example, someone being there watching them that's not normally there. So they relied on survey data because they felt that also parents were probably the most skilled person at observing their child and interpreting behaviors because of the wide types of behaviors seen on the autism spectrum disorder. It might be hard for a researcher to watch tape, for example, and accurately interpret why a child is doing something when a parent might be better at that.
Parents certainly have the most experience at watching their child.
So where one child does
they
a certain...
also probably have a large bias
that's a problem.
An unbiased observer might not have.
But they said, while one child might behave in a certain way and that's an improvement for them, for another child that might be the opposite. So it's hard to just come in as a researcher without knowing the person.
What did we get from this study? Seems like there's a lot of holes.
There's a lot of holes.
These people just wanted to give dogs to people.
Yeah.
That's what it sounded like.
I guess they would say that overall, the survey results showed that most of the children, particularly older children, and particularly those whose parents attending trainings to help with how to work with the dogs, did the best and reported an increase in social skills. The increase in social skills is particularly when the dog is present. It doesn't necessarily carry over to when they go to school and their dog's not there.
Well, it is interesting. It sounds to me like they need to do a little bit more research. Because one of the things is, maybe they did have a control group, but they did
have a control group that they didn't give dogs to.
Okay.
Yeah, so or that chose not to get dogs.
But when there's only one treatment group and one control group, and you're giving something to someone which in the past has shown a lot of other medical benefits, it's not incredibly...
It's so hard to... Well, and that's
it's not like a surprising result that
it's not a surprising
things got better.
And I guess maybe based on the video that kind of started my whole thing, the other surprising result is it's not an overwhelmingly, everybody had an amazing experience.
Yeah.
But I guess, that's what I would expect, that it would be kind of a modest positive.
Right. But for families looking for some type of treatment
that also might want to get a dog, because also all of these studies that I've pointed out that a dog could add stress to your life because it's another thing to deal with that you have to, I don't want to call a dog a thing. It's another thing that you have to do in your life, though, is to take the dog on a walk, to pay for the dog's food, to pay for the dog's vet care.
Vet care you have to care for.
Yeah. And I think, as in our general pet episode, I think people would generally argue that pets do add something to your life, regardless of stresses they might cause. Speaking of stress, let's talk about the other study that came from the University of Lincoln.
Okay.
Which was called Acquiring a Pet Dog Significantly Reduces Stress of Primary Carers for Children with Autism Spectrum Disorder.
Oh.
So this wasn't looking at the children's response. It was looking at their parents. Mostly, I'm assuming. They called them carers. They didn't say parents, so I'm not sure.
Perhaps it's a British term.
They don't say parents there? I don't know. This was also survey data because who knows if you're stressed but you, I guess.
I would think there are outcome measures for stress.
What do you think they are? Survey data.
Well,
how can you tell?
Off the top of my head, you can
heart rate?
Measure physical stress by heart rate variance. So,
well, anyways, they didn't do that.
Except the variability between beats is different. But.
And I understand. I know what you're saying. They didn't do that. Survey data. Their point in doing the study was that high level of stress would be common in any parents in general perhaps, but particularly parents of a child with a disability of any kind. And in the case of autism spectrum disorder, they have found that when the parent is really stressed, the child doesn't participate or do as well in other therapies or things that they're trying to do to treat their condition.
That makes sense to me.
So and when the parent is less stressed, the treatment or therapy is more effective. And also the parent is probably more healthy and more able to care for themselves and their child better if they're less stressed out. So this study, they took 38 primary carers who got a dog, and then their control group was 24.
They just didn't want to be exclusive.
Primary
One of them
carers.
wasn't a parent.
I guess if it's an adoptive parent or a foster home or something, I guess. I don't know.
There's probably one person that wasn't a parent, and so they had to change the whole thing to primary carers.
I guess. They
they
didn't explain why they chose that.
And then they never said it out loud to say how awkward it sounds.
Maybe it doesn't sound awkward if you're British. So they did pre-intervention surveys, which was done 17 weeks before acquiring a dog. They measured for all of those weeks, not just randomly 17 weeks before.
But why start 17 weeks before?
And they got a dog. And then they did a post-intervention, which was measuring from week 3 to week 10 after they got the dog. They let him have a couple weeks to adjust.
17?
I don't know. And then they did follow-up, which was 25 to 40 weeks after they got the dog.
Why not 34?
You really have a lot of questions for the authors of the study. And if you like, I can give you their email address, which was on the paper. They used a survey for the parents to fill out called the Parenting Stress Index.
Okay, see, this sounds like a good outcome measure.
Okay. So they found significant improvements for the intervention group for 3 of the 4 categories, which was the total stress, parental distress, and a category called difficult child.
Okay.
So they actually found that the parents initially in the pre-intervention phase were reporting clinically high levels in the parental distress category, and then they moved to normal.
Wait, how is parental distress different than total stress?
I think total stress is an average of all of the categories.
Oh, okay.
Yeah.
Okay. So they decreased their parental stress.
They decreased their parental stress significantly from a clinically significant level. Like,
what's the clinical diagnosis for parental stress?
Maybe just like you got too much going on.
Okay.
You're putting your health at risk. I don't know.
Parental stress disorder.
Yeah, they didn't. Another question. You have so many questions today that I wish I could answer. So those are my 2 studies from the University of Lincoln.
All right.
Any further questions about them at this time?
There are no King's College London, that's for sure.
I'll briefly summarize both of them and say they found some correlation between having a dog and decreased stress in parents and increased social skills in children, which probably could be related. Maybe if they're communicating better with their child, they're having less stress. Or if they feel like their child has an emotional connection with the dog that makes them feel happier.
I would imagine that. It's one kind of system where if you change one thing, everything else should change too.
Yeah.
A family like that.
Yeah. Now, I'm going to talk about one other study.
Okay.
It's more survey data. I'm really sorry about this.
Well, I expect more questions. Survey data is the worst kind of data, after all.
I'm really sorry about this.
That's okay. I literally didn't bring a single study to the podcast last week.
You didn't? Oh, yeah, that's right. You didn't. I had studies. I have 3 studies.
They were all non-studies.
So in the study, it was 70 parents of children with autism spectrum disorders.
Okay.
They found that the children that owned dogs, they just sorted them based on, do you have a dog? Do you not have a dog?
Sure.
They didn't have pre and post groups like the previous studies.
Should have been 17 weeks before and after.
Oh, my gosh. They found, though, that the children had, and it was just like they did a social skills improvement system rating scale. They also did another scale called the companion animal bonding scale to see how bonded they were. So children with dogs had greater scores on the social skills, and those with some type of pet that could be dogs but could be any other pet.
Fish.
Cat, hamster, whatever. Also had significantly greater social skills for being assertive.
Okay, interesting.
I guess maybe...
Pets make you assertive?
I guess. I'm not sure how.
Maybe because the kids had to assert themselves for their want for a pet.
Maybe.
And then the parents gave in.
Or maybe they had better self-esteem because they had a friend in their pet that they had a good relationship with.
Could be.
I don't know.
Could be.
They also, the children that had dogs complete this companion animal bonding scale, which showed that they felt very bonded with their dogs.
As one does.
Yeah, so I'm not sure why that's a surprising or unusual finding, except for that people in general, children with autism spectrum disorder, typically have trouble forming social relationships because of that problem with social skills.
So that makes sense.
Yeah, but everyone likes to be friends with a dog. Dogs want to be friends with everybody.
That's what the research shows.
So, I am sorry. I wish that there was more exciting, I thought there would be more exciting or touching stories here. But it's more kind of, dogs are probably helpful if your family would like a dog and you have a child with autism. Could be a good thing.
Let's leave it at that. Yeah. If you're thinking about getting a dog and you're dog people, then perhaps you should get one sooner rather than later.
And I would also, I don't know in the U.S. actually, but this UK group that offered the training specifically for having a pet dog with a child with autism, it was called PAWS.
Oh.
And they offered these trainings. I wonder if there's something similar in the U.S. I don't know, but it did, that was a thing that correlated with a higher success rate.
I would think, that would be pretty important, especially if at least part of your goal for having a dog with a child with autism is to be therapeutic. Then you should try and make the best of that with training of some sort.
And consider the type of dog, because I love my dog dearly, but I don't think she'd be suited for this because she's very...
unless the child was also quite active. Perhaps the dog's personality needs to be matched to the child's.
Yes. Also, she can react to unusual things, like people show up where she doesn't expect them suddenly or act in a way she doesn't expect. She'll bark at them loudly, which I don't think is probably helpful.
It is assertive, though.
Assertive, I don't know. I think she's not confident, which is why she does it. Anyways.
If you enjoyed the episode, please share us with a friend or give us a rating on iTunes.
You can visit our website, placebopodcast.com, for our show notes, or to send us any suggestions or feedback.
Don't visit the website if it hasn't been updated yet.
Yeah, just wait a day or two, and then it'll be good.
You can also find us on Facebook.
Thank you to James Aiken for our music.
And thank you to all of you for listening. We'll be back next week with a new episode.
Goodbye.
Bye.